Blondie here on the Q96.5 FM, about 6 minutes after the hour of 10 o'clock. And as advertised, as we whirl into our medical hour here today, I have on the line with me Jim Watkins, Health Commissioner here in Williams County. Jim, welcome in this morning.
Good morning, Jim.
Good to have you. I bet you guys have been busy over the course of the last 2 or 3 weeks since we talked.
Well, for us, it's been a little more than 2 or 3 weeks.
Yep.
This has been ongoing for us for some time. I mean, the last 2 or 3 weeks, or last, I don't even know anymore, it has certainly picked up, but it is something that has been going on for quite a while. The public may not know that, but for us, we've been following this and trying to prepare for quite a while.
When you say quite a while, beginning of the year, Jim?
Probably January, late January, we started to really start to have these concerns.
So when you took a look at this in January, it obviously, because you've done an awful lot of things here, it obviously struck a chord with the Williams County folks, and we saw it as a very big danger immediately, didn't we?
Well, I think we don't want to take credit for that. I want to certainly say that the Ohio Department of Health couldn't be more proud of our Department of Health here in the state, really grasping what the situation was. And, I can't say enough about our Governor DeWine, that his efforts to work with the director and let her guide him with the information to have a good strategy going forward. We are very, very fortunate that our state is where we are today because of the Director of Health as well as Governor DeWine.
So where are we today? I think an awful lot of folks at this point in time, every time they turn the television on, if they go on a national level, I think it's the state level's a little more realistic and a little more subdued. The national level gets a little more theatrical. Where are we in Williams County right now?
Well, I think that we are constantly here working with all our partners here in the community, which when I can't say enough about the hospital and Parkview Physicians as well as other entities within the county that we've been working with have been just spectacular for us to try and get the message out and try to prepare as a community as best we can. We've had good communication in the past, but I got to tell you, we are constantly speaking with them.
The telephones are going off, man. It's I bet that's been your life for a while, hasn't it, huh?
Yeah, I think I have Rachel on my cell phone. I think she got put on hold.
Okay.
On your system, so just a second.
Okay, because I can't tie her in as part of the problem here. I don't have the ability to tie her into this conversation with us. If you can, that's good, and if not, I guess we'll just we'll forge ahead. How's that?
We're good to go, Jim.
I figured as much. I've known you for a while, and you seem to have a good grasp on what you're doing, Jim. How's that? Tell me a little bit about where we are, because there are still an awful lot of people that will look at you and say, Jim, we aren't seeing anybody around here. Nobody's sick. Why are we all locked down? Why are we not going about our business? What's going on? This is a bunch of baloney.
Sure. So Jim, I'm going to make an attempt here to have Rachel via her cell phone.
Cool.
To address that. So,
okay.
Go ahead, Rachel.
Yeah. Can you all hear me fine?
Yeah.
We'll test here first.
Sounds good. I think you're doing pretty well, Rachel. Welcome in.
Hey, thanks for having me. So I think I'm understanding your question to be how our numbers may appear low, and so people are wondering how that should impact them or what they should be doing.
Yes.
So, sorry about that. My other phone rang. So what Ohio is doing right now. Testing has been an issue that many people cannot access right now, and so that is making our numbers look low. But we don't need to look very far to other examples around the world and even in the United States on how quickly things can pick up and become out of control. So the numbers right now are really just the tip of the iceberg because we are very limited on who we can test for COVID-19. So So in looking at that, we know that many people will have mild illness, and that will spread through the community. And so we're keeping a very close eye in Ohio on the number of hospitalizations, and that's rapidly picking up, and as well as the number of deaths that are happening because of COVID-19. So when we look at those numbers, it gives us a little more perspective on what's happening in our state and also within our community. So we know that we're about a 7 to 14 lag behind what's happening in New York in terms of the pace and hitting the curve. So what we need to be doing now in order to prepare for that is the whole flattening the curve strategies for physical distancing and social distancing. These are strategies that need to be done ahead of the curve because it's what will flatten it and make less people ill and less people die in our community from COVID-19.
So obviously you guys are very much in favor of the state lockdown that we just started now for the month of April?
Without question, Jim. I think that, I think one of the points I think that may resonate with some people in our community is that Dr. Acton made a point the other day that Ohio has an older population, and this is going to help. We know it's going to help. The data is starting to come in to show that the methods that have been employed with the stay-at-home here in Ohio have already had an effect. There is strong evidence showing that direction, that we would be in a much worse state had we not implemented those types of stay-at-home orders.
Guys, there's still, every time I see that map of coronavirus incidents around the state of Ohio, we still sit here in Williams County with a big zero on it. Jim and you and I were talking before we went on the air. Is it realistic to believe that we have nobody in Williams County that has not gone through this?
Rachel, you want to answer that?
Yeah, could you repeat the question for me, though, Jim?
Sure.
It's difficult for me to hear.
Yeah, no problem. Williams County still has a zero count in it, Rachel, and you touched on it a little bit. Is it really, honestly, realistic for us to think that nobody in Williams County right now does not have this virus?
That would be inaccurate to say that no one in Williams County has this virus. We're just really unable to test for it unless somebody is so severely ill that they're in the hospital. And so we know that we have people who are sort of the walking well, who are walking around with it, who've been exposed somewhere, whether it be from some travel that they've done or just from in the community. And what happens is those seeds get planted in our community and people become exposed to the virus. They have mild illness, they carry it, they go about their business, going to the grocery store or visiting people or going to things where there are larger groups of people, and those seeds keep spreading and getting planted. And then weeks later, somebody else will pick up that virus, and they can develop more illness from that depending on their own health situation or just the unfortunate luck of the draw where they might be having more severe illness because of it. We don't have to look very far. I'm going to point to Detroit, Michigan, as an example that is not far from us. And they are in a very difficult place right now with having many people who are ill and having their health system being overburdened and they can't take care of everybody. That is not far from us. That, in a way, is our neighbor. We're also not far from Chicago, who has also experienced a major influx of illness. It would be naive to say there is nobody in our community with COVID-19. It's been planted, it's here, and what we can do about it now in order to slow the spread in our community and take care of those persons who are going to be working in our healthcare system to take care of those severely ill is to do a very strict social distancing actions.
Have we seen, guys, more folks going to the hospitals, or is that something that you guys can address, or should I address that more towards the next two guests?
I think I would address that to them. They would have the most current information on that, Jim.
Okay, that sounds like a deal. We'll do that. Now, I heard Rachel say something about maybe we're 2 weeks behind where New York is at this point in time. So is it our estimate that we're going to start to see more cases pop up, Jim, over the course of the next couple weeks?
So I think that one of the things that Rachel's speaking to is that all you have to do is that if you look at what the Ohio Department of Health is reporting every day now, those numbers are continually going upward. So that was similar to what they saw in New York, and then as Rachel was expressing, the numbers got so large so quickly then that it overwhelmed them. That's what we're trying to do here in Ohio, is flatten that curve, trying to minimize how high this thing goes and how rapidly those numbers increase. One of the things Dr. Acton has made very clear is that we will not avoid this.
Yeah. And you can't get out of its way, so you got to take it head on. All right, I really appreciate Rachel Asherman and Jim Watkins' time here this morning. Before I let you go, Jim, you guys have been working an awful lot of hours right now. I think you have to be pretty grateful to the team that you got here in Williams County.
Oh, absolutely. We have a great staff here. Rachel's on the cell phone because we are scattered all over to try and protect ourselves. But the team has really pulled together. Can't thank the community enough for all their efforts to take on this burden of social distancing. And I see it in the community, and we can't express enough how much we appreciate the community doing that. And we just need them to continue on that effort. That's how we're going to keep this virus as low as possible within our community. So we can't thank the community enough.
Fantastic. Jim Watkins, Rachel Asherman, thank you for your time. Our next guest here this morning is going to be Dr. Jennifer Weber of Parkview Physicians Group. I'm going to step away here. We're in the middle of the medical hour. When we come back, we'll talk to Dr. Weber here on the Q 96.5 FM.